Good morning, my name is Jojo Thomas, and this is my oral presentation of strategic planning for Nursing 620. Welcome, thank you for participating in my presentation. This strategic plan is for Florida Hospital Surgical and Transplant Unit to increase the physician communication score in HCAHPS, that is, Hospital Consumer Assessment of Healthcare Providers and Systems. In detail, the nurse leaders facilitate RN-MD rounding, that's the nurses and the doctors rounding together to improve the patient satisfaction and increase the understanding about the treatment plan among patients. And it will result in higher patient satisfaction rate. Currently, transplant surgical unit, the physician communication score in HCAHPS is only 65%, which is far below expected 90%. With the recommended nurse-physician rounding, the goal is to bring a communication score above 90%. In a SWOT analysis of transplant surgical unit, the strength of transplant surgical units are there is a good nurse-patient ratio, a very cooperative physicians, good patient satisfaction score other than the doctor communication, supporting and determinant staff and leadership, a well-coordinated team of nurses and doctors. Weaknesses: there's a lack of expected round time for the nurses to coordinate with the doctor round, a patient not prepared for asking questions for the doctors, post-operative pain medications interfere with the patient's ability to ask questions during the doctor's round. Opportunities: with proper doctor-nurse rounding, there will be a better understanding among the healthcare team, and an increased patient safety can be attained too. Increased patient satisfaction with the proper communication with the doctors. Threats: although there is a good patient satisfaction in other areas, a lack of proper communication with the doctors affects the overall satisfaction of the unit. Patient safety is a big concern due to misunderstanding in the healthcare team. A lack of satisfaction can affect the overall business, as elective surgery patients may go for better outcome hospitals. A description of strategies to utilize. Personally, with an existing system of doctor round, there is only minimal information is shared with the patient, and that resulted in a lack of understanding among the patients and several miscommunication among the healthcare team. Implementing RN-MD rounding will be the strategy to potentially increase the score. RN-MD rounding is when the doctors and the nurses round together on patients in order to improve the communication and understanding. Studies have shown that RN-MD rounding, physicians felt that there is a significant decrease in the hierarchical distance, and the patients were able to have more ordinary conversation with the doctors. So the steps of the process is there will be a communication pad provided for patients to write down their specific questions in advance for the doctors to manage their time better. Physician will notify the unit secretaries about the room numbers that they will be visiting, and the unit secretaries will communicate that with the nurses. The nurse and the physician will have a pre-visit communication outside the room in order to update recent changes, and the nurse will actively involved in the rounding process, facilitating any question that the patient will have and addressing the communication pad. Communication plan for the process: there will be email out to all unit directors, medical directors to get adequate support. Communication will contain a problem, a plan for improvement, and the benefit of the plan. In detail, there will be an explanation of the unit-specific processes, including the expected role of nurses and doctors. Detailed communication to all employees and doctors in multiple forms, including email. Face-to-face communication will be provided. Message including the goal, the strategies, and the measures will be sent out. Our leaders will meet the employees to clarify any doubts or questions they have about the process. Leadership skills to draw upon the implementation of the plan. Rally people around a compelling purpose. Having that vital conversation with employees and team members are very important for a successful process. Individual conversation with the team members about the vital role will be very much useful. Continuous supervision and guidance should be provided to enhance success. shared control. Enabling the charge nurses, the silent leaders of the unit, to assess the RNMD rounding will help them motivate while assuring the success of the process. Unit secretaries will be asked to monitor the process and announce the doctor's presence in the units. Clarify norms and expectations. Clarification of nurses' role in the process, giving the opportunity for the nurses to ask questions will be very much useful. This completes the presentation about the strategic planning. Thank you for giving me an opportunity to present this topic. Please let me know if you have any questions. Thank you.